At the onset of the pandemic, WIEGO, in collaboration with its partners, conducted a mixed methods longitudinal study that examines impacts on almost 2,000 informal workers from 4 different sectors, including home-based workers, domestic workers, street vendors, and waste pickers. The study also considers how these impacts were felt by women workers as a result of the intersection of city-level restrictions, status in employment, place of work, and gendered norms and expectations. It's pressing for us to understand how the pandemic's economic shocks, health impacts, including vaccine inequity, and unpaid care work shouldered heavily by women can have substantial implications for the deepening of gender inequalities. Adverse impacts were strongly felt still by mid-2021. Home-based workers, for example, were the hardest hit of the 4 sectors, and only recovered 2% of pre-pandemic median earnings. Domestic workers who were actively working reported deteriorating work conditions, including longer hours and less pay. Pre-COVID median earnings recovery was also slower for women waste pickers and women street vendors in comparison to their male counterparts. And lastly, responsibilities placed on women for unpaid care work interrupted their employment more frequently than men's. More than a third of women and less than a quarter of men reported that increased unpaid care work prevented them from working or reduced their working hours. In the short term, national and local governments need to provide immediate relief to support workers and their households through cash grants, food support, and vaccine access. Governments also need to invest in existing livelihoods by facilitating access to loans and business capital, which can ultimately stimulate national economic recovery, but from the bottom up. In the long term, social protection policies need to respond to workers' demands for social security, health, and child care. The question at hand is whether governments are willing to center informal women workers as the primary vehicle for and metric of successful economic recovery, rather than trickle-down beneficiaries of recovery policies.